Migraine is more than just a bad headache. Approximately 1 in 4 adults aged 15 to 49 in the UK are living with migraine. While the exact origin is unknown, migraine attacks are thought to be caused by a combination of genetic factors and environmental factors. For example, fluctuating hormone levels, dehydration, lack of sleep, or skipping meals. Migraine attacks generally follow 4 stages, each of which is characterized by a range of symptoms. People with migraine may not experience all stages of a migraine. In the first stage, prodrome, areas of the brain are activated. During prodrome, patients may experience symptoms such as tiredness, neck pain or stiffness, sensitivity to light, and food cravings. The second stage, aura, is caused by a spreading wave of electrical activity in the outer layer of the brain called the cerebral cortex. People who experience aura commonly report spots of flickering lights near the center of their eye. Flashing lights and numbness in the face or arms may also occur. The third stage, headache, is caused by activation of the nerves in the head, face, and neck. Upon activation of these nerves, a sequence of events leads to a distinct migraine headache. A migraine headache is diagnosed as having at least 2 of the following characteristics: one-sided, throbbing, moderate or severe, and increases with physical activity. Migraine headache must be accompanied by at least one of the following: nausea and/or vomiting, or sensitivity to light and sound. The final stage of migraine is postdrome, where the brain blood flow is altered and people often report lack of energy, tiredness, sleepiness, and difficulty with concentration. There are steps that can be taken to reduce the burden of migraine. Consult your healthcare professional if migraine is affecting your quality of life.